This is me. This is the only picture I have of high school. That's me in the corner over there. I can barely see it. So I grew up, I was born in Mexico, and my father was a physician, so we moved here when I was in second grade. So I grew up in McAllen. I went to Texas A&M, I served in the military, went to Harvard, and then I trained in Miami. And hopefully someday, when my work in Ethiopia is done, when we'll come back here. So I have a very strong tie, and I just want to say, I've always thought the Valley was a very special place. Ethiopia, and I'm not going to give you a lot of facts, I just want to talk really about people. I mean, it's a country most of us didn't really think about. It's an agricultural society. Ethiopia has about 100 million people. 88% of them live on farms, and they live in rural communities, and most of them are pastoralists or they farm. A pastoralist is different than the ranching that we do here. They make the cattle like pets, they name them, they sleep in the house. And when we talk about transportation, this is it. Horses and your feet is the main mode of transportation. Most of the country, as I said, is highlands. What you see here in the picture are barley fields. Barley is one of their main staples. They'll typically live in very simple houses that don't have electricity or running water. And they're very neighbor dependent. I mean, they'll help each other tend their fields if someone is sick or injured. And children, Ethiopia is one of the youngest countries in the world. The average family has 6 children. The mortality rate has gone down, but it's a very young country, so they're having to build schools and provide health care facilities. That's part of what we do. We were the first ones to start taking care of neurosurgical problems in children. So let's talk about the medical problems. One of the biggest in the developing world, especially in Ethiopia, are birth defects. One of the things we know now that is a woman, before she gets pregnant, she has to take folic acid. And it usually comes in spinach or green vegetables. If they don't, then what happens is the brain and the spinal cord and the spine doesn't develop normally. This is an example. If you see this child on the left, you can see there's something sticking out between his eyes. That's actually the brain. The brain is going into the nose. And he's going to die like this. He'll eventually get an infection. The other problem is they believe in curses. The Muslims believe in a thing called the bleen, which are like devils. And the Christians believe in Badu. It's sort of like what Hispanics believe in the evil eye. So they believe that families are cursed. So not only, we have to take care of them, not only to solve the child's problem, but so that the community sees that the family's not cursed. So this child, this is about a 10-hour operation. And this is an example of waiting. This was the hospital in Desi where I was. And it would not be unusual for patients to wait weeks to months. You see the chair, you look at the 3, there's 2 Muslim ladies sitting there with their children. Those women sit there day and night on that wood chair waiting for a chance at surgery. So they'll wait there for days, weeks. They won't take a bath just because they're waiting for their chance. And I mean, literally, I'll show you the clinic. So we can only operate like 1 or 2 days a week.
Hearts Helping Hands is composed largely of Mac High class of 74 alumni who went to school with Tony. We would like to ask you to join our organization too, even if you're not from McAllen High School. We also want you to donate to Tony's work at Ayder Referral Hospital in Ethiopia. Every dollar you donate helps buy $10 to $20 in refurbished equipment and supplies. Any size donation is welcome. For up-to-date information, please go to our Hearts Helping Hands Facebook page. We truly appreciate your heartfelt support.